Hi, my name is Deanna Harris. This video is for Nursing 224, the insertion and removal of an NG tube. Prior to me going into my patient's room, I will assess for the chart for any nosebleeds, any signs of aspirations in the chart, any nasal polyps, any anticoagulant therapies, any chronic sinus infections, or any oral any sinuses or nasal surgeries. So I reviewed the chart. Then I go in, introduce myself. Hi, my name is Deanna. I'll be your nurse for today. Can you please state your name and your date of birth? Okay, great. So I will provide the patient with some privacy, and I'm just coming in to verify the orders of an NG2 placement from the physician and the removal of the NG2. Okay, great. So then I will have my supplies on a clean surface, have everything that I need there, and then I'll go ahead and perform hand hygiene. I'll come in and I'll inform the patient the reason for the NG tube is because of the bowel obstruction. And so what we're going to do is we're going to go ahead and insert that. And once we insert it, you should probably feel your nausea go away and any pain that you have associated. You may have a little bit of discomfort during the procedure, and you may gag once it's removed. So wanted to make sure that you didn't have any questions, or if you had any questions, that I'll go ahead and answer those for you. And then is it okay if I go ahead and do the NG tube insertion? Okay, great. Are you in any pain right now? Do you have any nausea? Do you have any vomiting? So patient states that they have a pain level of 4 out of 10, have a little bit of nausea. So we'll go ahead and give the patient some pain medication to kind of ease the pain. So then I will go ahead and perform hand hygiene again. I'll go ahead and place the patient in a high Fowler's position, and then I'll also raise the bed up to my hip level. I'll perform hand hygiene again, and then I will go ahead and get my tape and everything else that I need together. So I will go ahead and prepare my 2 strips of tape. And then one would be split in half. And about like that. And then I'll fold these over here. Okay. And then I'll just go ahead and put this on my clean surface here. I will open up my NG tube kit. Okay, and then I will go ahead and put my gloves on, just clean gloves. Then I'll take my pen light and I will use my pen light to look in the nasal passages here, and I'll look for a deviated septum. I'll look for some irritation to the mucosa. I'll also look for any obstruction or nasal polyps. There are none there. And I'll also confirm with the patient that they haven't had no recent nosebleeds, nasal trauma, or any nasal surgery. Okay, and then I'll also assess for bilateral patency. So if you can hold one nostril and breathe in, and then you're going to do the other side, hold the other nostril and breathe in. Okay, bilateral patency is noted. I'll also take a tongue depressor and assess for the gag reflex. And then I will also take my stethoscope and I will for assess for lung sounds. Okay, and since the patient is in semi-Fowler, I can also assess the back. Okay, great. And then I will also assess the bowel sounds. So I'll start in the lower right quadrant. Okay, and both lung and normal bowel sounds were heard. So after that, I'll go ahead and get ready to measure the NG tube on my patient. And so I will take this and I will measure from the tip of the nose to the ear. And then I will take from the tip of the nose, from the ear to the xiphoid process, the tip of the xiphoid process. And then I will take a marker and mark where I need to, that's where I will insert up to. Next, I will go ahead and get my patient comfortable. I will let them know that during this procedure that they will take some swallows of water. So I'll give them the water. I will go ahead and also give them a little drape or something just in case something comes out, an emesis basin, as well as some tissue. And I'll get all that together and give that to my patient. And then I'll take my NG tube and I will place some lubricant on my paper here, and I will lubricate 4 inches, the first 4 inches of my tube. And then I will go ahead and let the patient know that they will have some discomfort there, and that I'm going to go ahead and start the insertion. So I'm going to insert to with the position close to the patient's ear. So I will go ahead and start inserting. And then once I insert, I will go ahead and oh, wait, nope, won't insert yet. So I won't insert, but what I will do is I will take the 60cc syringe and I will attach it here. So this will be my 60cc syringe. There, I will attach it there, and then I will go ahead and insert the tube slowly, aiming to the back of the where the patient ear is. So then once I get there, I'll have the patient to tuck in his chin, and I will continue to have him to swallow. And every time he swallows, I will gently insert the NG tube, or the patient, I'll slowly insert the NG tube into the patient until I get to the marked number of insertion. So now I will go ahead and cover the nose here to stabilize it. And then I will take the pants, and wrap it around. Kind of hard doing it with gloves on here, but wrap it around. There we go. And secure it with the tape. And then I'll take my pen light and check the back of the throat and make sure that it's there. And then I will take my 60cc syringe and aspirate some of the gastric contents, hopefully there. And I will put it on the parchment paper or the pH paper to see if it's gastric juices there. It is acidic. So then I will then take the tube and put it back inside the gastric juices, put it back inside my patient. I would then auscultate the lungs. Nope. I will yes, I will auscultate the lungs and make sure lung sounds are clear, and check the patient's comfort level, make sure that the patient is okay, doing well, patient tolerated it well. And then I will go ahead and take a third piece of tape and tape it to their gown so it won't snag. And then I will also clamp the tube to the connector. And I'll let the patient know that everything is completed, and that will be the insertion. So then I'll take off my gloves, perform hand hygiene, but since we are going to go ahead and remove it, I'll keep these gloves on. But any other time you will come back into the room, you will introduce yourself again, perform hand hygiene, and let the patient know you're going to go ahead and remove the NG tube. You'll also let the patient know that upon removal, you may experience some gagging. And so that may take place. And so what I will do is I will go ahead and remove the tape from the patient's nose. Okay, and then I'll detach it from the gown. Okay, and then what I will do is I will have the patient to hold their breath. And as they're holding their breath, I will slowly release the NG tube from the patient's nose. And once the NG tube comes out, I'll inspect it for it being intact, and it is intact. So I'll go ahead and discard this in the appropriate reciprocal. I'll make sure that the patient has, I'll take all the things off of the patient, like the drape, and if they had tissues or anything like that. I'll then go ahead and place those in the proper reciprocal. I'll take my gloves off and make sure that my patient is comfortable. I'll perform hand hygiene and just reassess their comfort level, make sure that they're okay, make sure if I had put down any side rails, make sure that they're up. I'll go ahead and put the bed down in the lowest position. Again, I'll make sure that the bed is locked, that the call light is within reach, and I'll perform hand hygiene. And I will thank my patient for allowing me to come in and do the procedure. And that's it. Thank you.